the consequences for that is great. The patient might end with a permanent disability, or even death from even a simple viral infection. Why? Because nervous system cannot stand any type of infection without treatment, even the simplest one. This is number one. Number two, that the presentation of any viral or any infection in the nervous system, sometimes the early manifestation, we call it the prodromal features, could be similar to any infection. And that could be missed and misdiagnosed. So have to be very careful. During this lecture, we'll highlight certain points which will help you in the early diagnosis of the disease. Because the earliest you diagnose the patient, you are more to save that patient. The late diagnosis, you will have a problem and the patient have a problem. And this problem could be very dangerous and death sometimes. Okay. Now, the infection of the nerve could happen to many organisms. Many organisms could infect the nervous system. For example, bacterial infection, viral infection, fungal infection, and other rare type of infection. And the bacterial infections could involve the meninges, the covering of the nervous system, leading to meningitis, and we will discuss this later on. Or the infection could involve the cerebral cortex. And because it is bacterial, that's why we call it suppurative encephalitis. Suppurative encephalitis, and sometimes the infection is localized in a brain abscess, And sometimes the infection down in the spinal cord, and that is the paravertebral or epidural abscess or infection. Also, we have a special type of infection like tuberculosis. And tuberculosis, one of the causes of chronic infection. We have other rare problem like leprosy. And leprosy could affect the peripheral nervous system. And also we have the neurosyphilis, the diphtheria, and tetanus. The viral infection, just the same, could affect the meninges, causing meningitis, the cerebral cortex, encephalitis, or the spinal cord, called transverse myelitis. Any myelitis means spinal cord inflammation. Myelitis means spinal cord inflammation, and it could be transverse myelitis. And we have another type of complicated viral infection, and that's called progressive multifocal leukoencephalopathy, which is very dangerous, unusual, complicated viral encephalitis, with the mortality and morbidity is very, very high. And also, we have what we call the subacute sclerosing panencephalitis, late sequelae. will lead with mental retardation. Polio, most of you know what's polio and what the problem is of polio, okay? And could cause the viral infection with a lot of morbidity, rabies, and of course HIV infection. We should not forget fungal infection. And the fungal infection like candidate meningitis. وهذا نشوفه حقيقة احنا الفنجل infection is not very common. فاحنا هتشوفون بعدين with the management احنا we treat the patient before we identify the organism, because sometimes the identifications of the organism will take some time. So we give the patient treatment, the usual broad spectrum antibiotics, empirical treatment, هنشوفها بعدين. ونشوف there is no response, although the patient is taking proper bactericidal drugs, but there is no response. And the result of the investigation came later on to find that the infection is not bacterial, it's a fungal. And fungal infection is a serious infection and need special type of therapy. And also, the fungal infection could also cause localized brain infection like a brain abscess. Okay. So we start with the inflammation of the meninges, the meningitis. Now, meningitis, it is a syndrome composed of fever as any febrile illness, but this fever is combined with headache. وطبعا تعرفون any febrile illness they have fever and headache. وهنا هي this is the difficulty of distinguishing the infection is in the nervous system and not somewhere else. By the third manifestation, and that is the meningismus. Meningismus. So always in any febrile illness with headache, exclude meningismus وراح نتكلم على المنن in detail. In detail. You have to demonstrate there is sign of meningeal irritation like neck stiffness. طبعا هذا الفيبر وهدك meningismus associated with inflammation in the subarachnoid space. And this is detected by examination of the CSF. You find there is increase in the number of cells, indicate infection. Now, what is meningismus? Again, headache, fever, and meningismus. The meningismus has a special type of headache, severe headache, associated with photophobia. Photophobia, meaning the light is irritating the eyes of the patient. He cannot look to the light. And neck stiffness. So simply, إذا أنت بالطوارئ, yes, sometimes you are overcrowded, مرضى كثير, بس أي واحد يجيك headache and fever, ask about other additional symptoms. Photophobia. And put your hand behind his neck and look for any neck stiffness. This make a difference between life and death. Life and death. Because if you diagnose the patient early with meningitis, you save the patient. But if you don't diagnose it, you might lose your patient, or the patient will be finished with permanent disability. So there is another sign, accompanying sign of meningeal irritation like Kernig sign. راح أتكلم عليه بعدين طبعا. By the way, meningismus is not specific for meningitis. could occur any irritation of subarachnoid space, like in subarachnoid hemorrhage. And this is differential diagnosis. Now blood is irritating. Now they found that the severity of the clinical features varies according to the causative organism. هذا راح نشوفها بعدين. We will discuss a type of organism and the clinical representation. Some of the organisms, they have very severe illness, and the patient could die within hours. So it depends on the nature of the causative organism. And also the presence of other complication or features like skin rash or skin hemorrhage, and a special type of bacterial meningitis راح نتكلم عليها. Now the Kernig sign هذا اللي حكينا عليه، انه you ask the patient to lie flat, take the pillow off. لازم يكون الهيد والبودي on the same alignment. دائما ينام وتوخر البد. Then you make flexion of the knee. High flexion of the knee 90 degree. Then you have hip flexion either 90 degree. Then 90. Then you do extension of the knee. تعمل extension of the knee. The extension is very painful. And the pain will limit the extension. The extension will be limited. ترفعها لفوق تشوف المريض عنده very severe pain at the back or at the neck. This is the Kernig sign. The other sign is the Brodzinski sign. The same thing. You ask the patient to lie flat, pillow off, then you put your hand behind the back, lower back of the head and the neck, and try to flex the neck. There is passive flexion of the neck. This leads to hip and knee flexion. And there is resistance to the flexion, meningeal irritation. As we mentioned before, the meningitis could be caused by many organisms, bacterial, virus, and different type of virus, كما حكينا. But sometimes, rarely, be caused by a protozoal, like amoebiasis or toxoplasmosis. Someone fungal should not be bothered. And a special type or entity called non-infective, sterile. And that is when the subarachnoid space is invaded by malignant disease. Also, راح اشوف من تعمل culture وتعمل CSF تشوفها ما في بكتيريا بس اكو malignant cell or breast bronchial cancer or blood disorders like leukemia or lymphoma, and sometimes inflammatory disease or connective disease like systemic lupus erythematosus, sarcoidosis, or Behçet disease. Okay. We divide the meningitis into acute and chronic for description. In acute meningitis, by definition, the presentation within hours, sometimes few days, hours. And the most likely the infection is with bacterial or viral cause. طبعا differential diagnosis of non-infectious etiology. They found that the morbidity, complication, mortality, the death of bacterial meningitis is very high, substantial, very, very high, if not diagnosed and treated early. هذه المسج اللي واحد ياخذها معه. It's also important to sudden or quick, prompt recognition and management of potential cause. It is a neurological emergency. We have another entity called chronic meningitis. And by definition, it's chronic, it's longer than 4 weeks. And that will give us special type of bacteria, like TB meningitis. راح أتكلم عليها بعدين. Now there are certain predisposing factors, عوامل مساعدة. For example, environmental factors, overcrowding and poverty. وهاي شافوها مثلا في مكانات مزدحمة كثير، اوكي، أو مكانات مكتظة بالسكان. ليش overcrowding؟ لأنه usually the organism is carried out in the nasopharynx. And when the patient sneezes or coughs, you will spread the organism. Poverty, those people who live in poverty, usually they are malnourished and their immunity is low. So they are liable for infection. We have certain host factor as a predisposing factor. For example, patients with diseases of immunity, immunological deficiency. واضح. Even they found patients with sickle cell disease liable more. Or alcoholism. Though the patient alcoholic, usually they are malnourished. ليش؟ لأنه عنده limited amount of money. فهي pay for buying alcohol rather buying food for himself or his family. فيصير malnutrition. And of course, ما بننسى diabetes, predisposing factor to any infection, and CNS infection and meningitis is not exclusion. Sometimes we have infection of mixed etiology, and this is following head injury. With head injury, RTA, is an open wound on the ground, a different type of organism enter the skull. Or patient in the mastoid infection, or sometimes iatrogenic after lumbar puncture. دائما طبعا lumbar puncture is part of the investigation to take CSF. لكن this should be done in a sterile procedure. لازم البيشنت الدكتور عنده sterile gloves and the sterile gown and mask, and he will sterilize the skin at the site of the lumbar puncture. If this is not done properly, then organism from the skin will be introduced into the subarachnoid space. Iatrogenic. Now, how the bacteria goes to the subarachnoid space? It invades the subarachnoid space either directly by spread from nearby structure, continuous structures. For example, sinus infection, more common, or middle ear infection, okay? Or indirectly from bloodstream. هذول البيشنت اللي عندهم septicemia, and the organism is in the blood, and through the blood goes to the blood-brain barrier and then goes to the CNS. What are the causative organisms? But now we classify the causative organism according to the age. For example, early life in a neonate, we have the gram-negative bacilli, like the E. coli. Why? Because especially during delivery, the birth canal is nearby the GI canal. And the GI canal, there is the E. coli. And the E. coli could transmit it to the birth canal, and a new baby could have infection, meningitis, like E. coli. Also, Klebsiella and Haemophilus influenza, common in young, in neonate. And those organisms are sensitive to the antibiotic ampicillin with cefotraxone. In children, few years old, Also, the common problem is Haemophilus influenza. But pneumococcus, Streptococcus pneumonia, or meningococcus, Neisseria meningitis, could be another cause. In adults, the pneumococcus is common, meningococcus, or other bacterial or Streptococcus pyogenes. We should not forget Staphylococcus aureus sometimes cause infection. Okay? So we have host factor problem in the host, like congenital abnormalities, AIDS, hypocyclinism, and immune deficiency, and alcoholism. What are the clinical features? هاي مهمة. Now, the classical triad are fever, headache, but with neck stiffness. يمكن يجوا 50 مريض بالطوارئ بالليل كلهم فيفر، هذه خاصة during winter time, flu-like illness. Okay. Try to save few seconds, less than a minute, put your hand behind the back of the head and the neck and try to flex the neck. You will find there is neck stiffness. The infection passes into stages. The first one is the prodromal features. طبعا the prodromal features are before the full picture, variable according to the causative organism and according to the basic health status of the patient. And in the prodromal feature, the patient could have respiratory tract infection, or ear infection, otitis media, or could have a pneumonia. And all these diseases will cause طبعا muscle pain, backache, and lethargy, which is non-specific. Non-specific. And now this is early stage. بعدين يصير complication. Then after that, meningitic symptom develop. Patient have severe frontal and occipital headache. يختلف. You have to differentiate this headache from other type of headache. المحاضرة الثالثة راح تكون الهيديك. We have to differentiate it from other type of headache like tension headache or migraine. Severe frontal and occipital. Plus neck stiffness, stiff neck, plus photophobia. هذا الثلاث أشياء. هاي أهم شيء. نقطة 2 و3 تميز لك الهيديك due to CNS infection. Sometimes we have systemic signs. There is high fever. Or sometimes in special type, like in meningococcal meningitis, we have a transient purpuric or petechial skin rash. Purpuric or petechial skin rash. So these are the symptoms of meningitis. You could have a central symptom, headache. And sometimes in severe case, altered mental status. Patient have photophobia, dislike the light, cannot look to the light. And there is systemic features like high fever and sometimes presented with seizure and stiff neck and restlessness and sleeplessness. He cannot sleep. وهذا special in young. The mother, especially young mother, ما شايفة بالأمراض من أول تحكي تقول لنا طفلي the child has fever and he cannot sleep. He just or difficulty with walking. Sometimes phonophobia. There is pain, muscular pain, and fatigue. Sometimes GI symptoms, nausea, vomiting, or skin changes. What are the meningitic signs? Yes, stiff neck stiffness, and Kernig sign. هذا حكينا عليه برودنسكي والكيرنيك. But sometimes in severe cases, we have other associated neurological signs in severe cases. Like, for example, impaired conscious level. This is a severe one. or focal or generalized seizure, frequently about 30%. Or sometimes cranial nerve sign paralysis in 15%. Or deafness, sensorineuronal, not due to direct infection, but it's an autoimmune reaction, 20%. Or sometimes due to the direct cochlear involvement. Okay, this is مثل ما حكينا عليه, this is the Kernig sign, وthis is the Brodzinski sign. هاي بالأطفال خلي الطفل ينام, تعمل له neck flexion, ويصير flexion of the hip and the knee. Same thing here, this is the Kernig sign, and this is the Brodzinski sign. Okay. In certain cases, we have complication by the development of focal neurological sign, like, for example, hemiparesis, dysphasia, hemianopia, in 10%. But sometimes in severe cases, we have non-neurological complication. وهاي مهمة, تجي بالمultiple choice question. For example, shock, and the shock due to adrenal failure, especially with adrenal hemorrhage. Or we have coagulation disorder, thrombocytopenia. Or serious problem like disseminated intravascular coagulation, DIC, serious complication. Or inappropriate ADH secretion with electrolyte disturbances. We could have septic complication, like involvement of the joint, arthritis, either direct infection or immune complex deposition. Or we could have acute bacterial endocarditis. Now, we have certain features specific to the causative organism. مثلا, Haemophilus influenza meningitis, the following character, why تجي بالmultiple choice question, generally occur in small children, young, واحد. Number two, presenting or preceded by upper respiratory tract infection. في عنده upper respiratory tract infection. An onset abrupt, sudden, with brief prodromal features. Outcome generally good. Mortality less than 5%. High Haemophilus influenza. أما meningococcal meningitis often occur in epidemic. Why? Because the organism is carried out in the nasopharynx. Associated with meningitis, there is septicemia, with arthralgia and purpuric skin rash. When the infection, meningococcal infection, is very severe, overwhelming, there might be confluent hemorrhages appear in the skin due to DIC. They found that gradual onset carry a good prognosis. On the other hand, sudden onset with septicemia, poor outcome, and the mortality 10% or more. Meningococcal. And this is the hemorrhage under the skin. Hemorrhage under the skin. What are the complications of meningococcal infection? You have meningococcal septicemia, meningitis, rash, shock, DIC, renal failure, and peripheral gangrene sometimes, and arthritis, septic or reactive, or pericarditis. What about the pneumococcal meningitis? It's usually adult disorders at the adulthood, associated with weight loss, debilitation, weight loss, and malnutrition associated with alcoholism. هذول chronic alcoholic، وخاصة برا بالخارج دول الهوملس اللي عايشين تحت الجسور، homeless alcoholic. May result from pneumonia, complication of pneumonia, or middle ear infection, or sinus infection, or could follow splenectomy. The onset may be very severe, very acute, نسميها explosive, انفجارية, and the progressing to death within a few hours. So it's a severe disease. And the mortality is 20%. What are the poor prognostic signs? The patient is presented with coma, or with seizure, or when you examine the CSF, you find very low cell count. Okay. And then, and the patient suspected meningitis. You have to do investigation. Before you do investigation, a general rule. If your patient is in coma, presented in coma, or you examine and you found there is papal edema due to raised intracranial pressure, or the patient have focal neurological sign, you have to exclude an intracranial lesion, mass lesion, with a proper CT scan, or MI, or meningeal enhancement. If the patient is deteriorating rapidly, تعبان clear, or has bleeding disorder cannot be controlled, correct. Immediately, emergency. Okay? If the bleeding disorder cannot be corrected, it's an emergency, take off a blood culture and start empirical antibiotic prior to the scan. هنتكلم عليها بعدين. Are absent and CT exclude mass lesion, confirm diagnosis with lumbar puncture to identify the organism. The CSF, the normal value, دائما the color of the CSF is colorless, crystal clear, clear. أما إذا صار turbid, it's infection. إذا كان bloody, get hemorrhage. Cell count are very few, less than 5. And the glucose, تقريبا 40 to 80 milligram. Okay? And the protein is also between 140 to 400 milligram. This is the normal value. And the pressure also is normal. The pressure, CSF pressure, CSF pressure. لأنه دائما بالCSF كيت موجودة العدة هاي، أنت تعمل sterilization، تخلي CSF needle connected to a manometer، فيطلع عندك CSF pressure، أول شيء تقيس CSF pressure. دائما يكون normal، لكن will be increase in infection. بعدين تاخذ sample for investigation. If there is meningitis, for example, there is increase in the pressure. Number one. The appearance not clear is turbid and sometimes purulent. And when you do staining, you find a gram-positive pneumococci or hemophilus negative bacilli. Okay. Also, the cell count is elevated, 100 or even 1,000. In bacterial infection, polymorph, or could be lymphocyte and viral infection. Glucose will be low. Glucose will be low, and protein will be high. Okay? And the enzyme lactate dehydrogenase is elevated. And also, you do the PCR to identification of the DNA of the causative organism. طبعا تاخذ sample for culture. High example of CSF changes. هذا normal, appearance clear, pressure normal, هذا النورمال pressure. White BC very low, protein normal, glucose. أما بالبكتيريال meningitis change to turbid. Pressure elevated, cell elevated, protein elevated, and glucose low. In viral meningitis, the CSF could be clear. The pressure could be normal, like in cell raised, but it's lymphocyte. وطبعا البروتين within normal والجلوكوز within normal. In fungal meningitis, clear, elevated, raised, low. هاي أيضا evidence type مال البكتيريال and the viral fungal. التي بي راح نتكلم عليه بعدين. The pressure is very high, very high, which cells is high. We had differential count أيضا, when the protein is very high, the glucose is very low. And this is the color of the CSF, turbid. Okay. There are certain immunological tests, وهذا غير كثير شغلات. وأهم شيء هو PCR, polymerase chain reaction in the CSF and the blood, to identify the etiological agent, bacterial DNA. هذه بعد يومين أو 3 أيام تجيك الريزلت البي سي ار يقول لك الأورجانيزم this organism، لأن فيها DNA موجود وشخص الأورجانيزم الموجود. والبي سي ار جدا جدا مهم. لما تاخذ السي اس اف تبعث على البي سي ار، وايضا تاخذ البلد تبعث البي سي ار. طبعا you send blood culture for blood culture for organism تقريبا 80% could be positive. Okay, in Haemophilus influenza. In pneumococcus less than this, 50%. ايضا you send for electrolytes, because sometimes we have inappropriate antidiuretic hormone and electrolyte disturbances. You should not forget to do investigation to detect the source of infection. Meningitis had an infection. For example, the chest examination, chest x-ray, or sinus, or skull, especially in traumatic injury. Treatment. Now, once you suspect meningitis, best suspicions, immediately you do isolation. Why? Because the organism could be carried out in the nasopharynx. إذن لازم تخليه in isolated room. تحكي مع حتى لو بالليل انت بالمناوبة، تحكي مع الإدارة المناوبة، تقول لهم عندي كيس meningitis بدي isolation. This is by law. بالقانون، لانه اذا ما دخلتها بالرتها العاديه راح تحاسب عليها، لانه if you admit him to the usual medical ward you will transmit infection. إذن isolation. And immediately you do the CSF examination after seclusion, papilledema, raised intracranial pressure by fundoscopy. قبل لا تعمل CSF تنظر ophthalmoscope if there is papilledema or not. إذا ما papilledema no resonant pressure then تعمل CSF. وبعد ذلك immediately you start what we call it empirical treatment. ايش راح نقصد بالempirical treatment؟ من antibiotic you start immediately before the identification of the causative organism. And the empirical antibiotic has the character must penetrate the CSF, and in appropriate bactericidal dose, and be sensitive to the causative organism once identified. خلينا نشوف example. Initial therapy before organism is identified. دائما بالنيونيت حكينا الامبيريكال تريتمنت هو الامبيسيلين سيفتراكسون. بالchildren نسويها سيفتراكسون and vancomycin. Empirical treatment. Same thing. ceftriaxone and vancomycin. إذا كان البيشنت immune compromised نضيف بالإضافة إلى الفانكومايسين ceftriaxone نضيف الأمبيسيلين. والعلاج for at least 2 weeks, sometimes 3 weeks. مريض يمكن خلال أول يوم ثاني يوم he feel better and he want to go home. By law he should not go home أبدا، ما يطلع الدار. يكمل علاج أسبوعين إلى 3 أسابيع، أسبوعين at least 2 weeks. This is by law، مو بإيدك، بالقانون هذا. لأنه إذا راح خلال يوم partially treated بس الريزيستنس عنده بعدين ويعمل spreading of the infection. Now, if your patient is deteriorating, how you monitor? In a deteriorating patient, أنت تعطيه proper empirical treatment. لكن your patient is deteriorating. So you would like to see why the patient is deteriorating. You have to do a CT scan to exclude the following. Number 1, hydrocephalus, because of the adhesion and inflammation of subarachnoid space and membrane, and that leads to obstruction and dilatation of the ventricle. Or formation of brain abscess, the infection spread from the meninges going to the cerebral cortex, causing brain abscess. Or subdural impairment. هاي الثلاث أشياء should be excluded. هاي تجي على شكل multiple choice. Sometimes we have another complication, like sinus thrombosis. If you suspect thrombosis, that MRI venography required. طبعا بالإضافة إلى ذلك we have to remove the source of infection, like mastoid infection. Chemoprophylaxis to those in direct contact with the patient, family member. And usually, especially in meningococcal meningitis, the risk of the household contact is very high, 500 to 800 times. And the chemoprophylaxis should be offered, like rifampicin, 600 milligrams twice a day for 2 to 3 days. Or ciprofloxacin, this is chemoprophylaxis. Finally, vaccine. The vaccine changed the presentation of meningitis, and the meningitis now become less frequent. And it's available for Haemophilus influenza, especially in very young children, between 2 to 15 months. Should be routinely immunized against Haemophilus influenza. And the age between 1 to 18 years for Neisseria meningitis. And adult 65 in streptococcal pneumonia. وهذا تلاحظ هسه حتى بالادلت سبيشال هذول اللي يروحون على الاماكن المقدسه للعمره او للحج should be immunized against streptococcal pneumonia لانه بهاي المراسم الحج او العمره overcrowding وجايين من مختلف البيئات من افريقيا ومن اسيا ومن امريكا ومن كل مكان and they could carry any infection. Now, questions of steroid. In adult, the benefit of steroid is less certain. ما مؤكد الفائدة مالته. ما نعطي. But in a critically ill patient, you have to do intensive support therapy. وضمن ال requirement of the intensive support therapy you add steroid. كواحد critically ill يجي شوك فهنا نستعمل الستيرويد in this condition. أما normally no steroid is indicated. هذا واحد. نشوف بعدين. نجي على special type هو ال TB meningitis. Organism by TB. And the meningitis is the common manifestation of a tuberculous infection. TB meningitis in children usually result from bacteremia following the initial phase of a primary pulmonary tuberculosis. Primary phase. Bacteremia قد يسبب meningitis, especially in area when TB is very epidemic. منتشر. أما an adult, it may occur many years after the primary infection by reactivation of the focus in the lung. The clinical features of TB meningitis result from the following. The infection of TB meningitis causes severe infection, exudation in the subarachnoid space, and this results in obstruction to the CSF flow, especially at the base of the brain, at the basal cisterna. basal cisterna. هذا يسبب hydrocephalus. هذا واحد. أيضا one of the complications is vasculitis, small blood vessels in the brain, and this results secondary inflammation around the blood vessel, resulting in infarction of the brain and spinal cord. وثلاثة, the basal meninges are generally most severely affected or severely affected. The clinical features, the majority of patients are adult. ليش؟ لأن childhood TB is rare because of the immunization موجودة. بها stages or chronic. Stage 1, non-specific, prodromal or prodromal symptoms. High, the prodromal symptoms over 2 to 6 weeks. بعض الأحيان the patient يجي as a fever of unknown origin. Now the stages is very useful for the outcome. For example, in stage 1 early, it is non-specific. Fever 80% and lethargy. هذا يجي على شكل فيو. لكن stage 2 intermediate, the patient become confused or cranial nerve paralysis with meningism. Vasculitis could develop with hemiparesis, quadriparesis, ataxia, or dysarthria. Stage 3, coma, pass into coma. What are complications? Many complications. Seizure at the onset of the disease, or involuntary movement like chorea. But atypically, the illness may develop very slowly over months, presented with dementia. Or sometimes the presentation is so rapid, it's similar and like the pyogenic bacterial meningitis. فهو في two ways, أما يكون too chronic or too acute. Now, occasionally, the cerebral feature prevail more than the sign of meningitis. If untreated, the illness may progress from phase 1 to death in a 3 weeks period. Complication, inflammation of the subarachnoid space, arachnoiditis. And this leads to inflammatory exudate, result in obstruction of the CSF, result in hydrocephalus, or chronically result in dementia, or in blindness. We suspect we do investigation, and the investigation showed anemia, and leukocytosis, hyponatremia, and appropriate ADH. وطبعا تبعت على PCR. And the CSF examination, you show there's lymphocyte usually present. Like sometime in the acute phase, there might be a polymorph. طبعا the protein is very, very, very high. Glucose is very, very, very low, and the pressure is high. This is the TB. The pressure is very high, and the white BC high, lymphocyte glucose is very low, protein is very high. Other investigation, you do the Nielsen staining, macroscopical examination for the acid-fast bacilli in 20%. Culture would take a long time, about 6 weeks, while Winston, Jensen, medium, confirmed diagnosis. But the PCR or polymerase chain is very important, available to detect the bacterial DNA. Other investigation, you look for source of infection, like a chest X-ray or a CT chest, to reveal change of TB in 50 to 70% of patients. Okay. Sometimes we need MRI to show meningeal enhancement, especially basal meninges. Sometimes it shows ventricular enlargement, or sometimes infarction, or tuberculoma, or like collection of infection inside the cerebral cortex causing tuberculoma in 10%. How we diagnose? We diagnose on a clinical presentation, plus the staining with Nielsen. But if the Nielsen is negative, because of the progression of the disease, don't wait the result of culture. Start treatment. And the TB meningitis come in the differential diagnosis of subacute or chronic meningitis. هاي مهمة. شو هي أسباب السبacute or chronic meningitis؟ Number 1, viral meningococcal encephalitis with normal CSF. Carcinomatous meningitis with high CSF protein, low sugar. Or partially treated bacterial meningitis or fungal meningitis. 1 2 3 4. هتجي على شكل multiple choice. If you suspect case of TB meningitis, you start the anti-tuberculous treatment. And the recommended program is the program for treatment of TB. أعتقد medicine. لكن هو not bridge. First 2 months, شوف التريتمنت يطول هون. First 2 months you start by INH, isoniazide, 300 milligram per day, plus pyridoxine. Pyridoxine will be 6 per day to reduce complication of polyneuropathy, plus rifampicin, plus pyrazinamide, and streptomycin. In the first 2 months. بعدين بين الشهر 7 إلى 12, 7 to 12, you add INH and rifampicin only. A resistant case يدخل في الاميكاسين. أرى تاخذون التي بي تكون سهلة عليكم. نجي على الستيرويد ثيرابي. نعم تختلف. Many doctors and the clinician combine the anti-TB therapy with the steroid. Why? In hope that this will minimize the risk of obstructive endarteritis and arachnoiditis adhesion. حتى يمنع الادهيجن ويمنع الارترايتس. many doctors يضيفون الستيرويد treatment. steroid مع anti-TB treatment. لكن although the benefit is uncertain, لكن certainly steroids are recommended in a patient is very ill with deteriorating level of consciousness, progressive neurological sign or evidence of spinal block. لازم نضيفها. نجي على البرين تيوبركلوما مثل البرين ابسس بالبكتيريال انفكشن collection of infection بالcerebral cortex and يصير tuberculoma. Many may occur in cerebral hemisphere or cerebellum or in the brainstem, with or without tuberculous meningitis. It produces space-occupying lesion, and the lesion may be single or multiple. CT scan and MRI could demonstrate the lesion. and most resolve with treatment with anti-TB. This is the this is the tuberculoma. Tuberculoma. Okay. Finally, we have the viral meningitis, and presented with headache, fever, neck stiffness, as any meningitis. But the patient may do not appear as ill as those with bacterial meningitis. It is milder. And also, there is systemic viral infection associated, causing skin rash, lymphadenopathy, pleurisy, carditis, organomegaly. And then evidence of viral infection. And treatment antiviral acyclovir. Amma viral encephalitis, it is very serious a problem. The patient presented with acute confusional state. There is changes in the level of consciousness. Could be drowsy, sleepy, or comatose, or presented with seizure, or sometimes presented with focal neurological sign. It is in the differential diagnosis of acute confusional state. طبعا treatment هو acyclovir and intensive care unit. A special type of viral infection بخمس دقائق هو الherpes simplex. And the herpes simplex encephalitis usually caused by herpes simplex type 1, oral herpes. Most common cause and cause sporadic fatal encephalitis. With headache, neck stiffness, vomiting, and behavior disorders, and memory loss, and neurological signs like hemiparesis, or focal or generalized seizure. Then high a presentation of herpes simplex encephalitis. Serious illness. Mortality and morbidity is very, very high. And this is the sign of herpes simplex encephalitis. And usually it is very rapid progressive disease over several days to coma or death. Those who survive will end with memory loss or behavior changes. And the CSF showed increase in the protein and lymphocytosis. And mild protein elevation. Differential diagnosis, brain abscess. Treatment, admission to the intensive care, acyclovir, and supportive therapy. And the prognosis is not good. Finally, we have differential diagnosis of chronic meningitis causes. Number one, infection. Partially treated bacterial meningitis or TB meningitis, or other, like syphilitic or Lyme disease, especially in America, North America, or brucellosis, sometimes brucellosis, or HIV infection, or fungal infection, or parasitic infection. هذا واحد infection causes chronic meningitis. Non-infectious, like neoplastic meningitis, or chemical meningitis, or subarachnoid hemorrhage, sarcoidosis, Behçet disease, and so on. Thank you. ارتاحون شوي حتى ناخذ